Hey everyone, this is Claire Latimer, and I'm presenting my final project on the infectious disease feline panleukopenia. I wanted to present on this topic because when I first started working 2 years ago at the shelter that I'm at, we had a huge panleuk outbreak. For the entire summer, at least one cat almost every day was dying due to this disease, so I wanted to shed light on how to prevent it and what exactly was happening. Feline panleukopenia is caused by the feline parvovirus, or FPV. It's also known as feline distemper or feline parvo, or just panleuk as we call it in the shelter that I work at. It's very contagious, spread through the fecal-oral route when cats are grooming themselves, or if they come in contact with trace amounts of feces in their food, or just stuck in their cage from improper cleaning. It can also be transmitted through fomites such as a worker's clothing or shoes. The virus targets and kills rapidly growing and dividing cells such as in the bone marrow, lymph nodes, intestines, and in developing fetuses of pregnant mothers. The destruction of cells in the intestines is what causes the severe diarrhea. If a pregnant mama cat becomes infected with panleuk, even if the symptoms don't seem that severe, she may abort her babies. Or if infected later in the pregnancy, they have a chance of being born with cerebellar hypoplasia, which affects their coordination. This virus often has a high mortality rate, with over 90% of kittens dying if infected. Adult cats are much less likely to die from the virus due to vaccination history and just stronger immune systems in general. That's why it was so strange at my work. We had full-grown adults dying from panleuk almost daily, and it was really devastating to be a part of it and to try to figure out why this was happening. The virus is non-enveloped, making it very stable and resistant in the environment. It can stay alive within an environment for months and sometimes years if not cleaned appropriately. The most common symptoms you will see with a panleuk-infected cat are lethargy, anorexia, diarrhea, vomiting, dehydration, and leukopenia. Leukopenia is a decrease in the number of white blood cells from the virus attacking the lymph nodes and bone marrow. It can usually only be detected by running a CBC, which many shelters may not have the resources for. The diarrhea may be bloody as shown in the picture, but that's not always the case. Affected cats may overall just be depressed and dumpy in appearance. So how do we know if a cat actually has panleukopenia? The rule we use at my job is if we see any two of the listed symptoms at the same time, we alert a veterinarian right away. These symptoms don't always mean panleuk, and they actually look a lot like salmonella, foreign bodies, pancreatitis, or even just a really bad case of worms. A vet will evaluate the symptoms and the history together to decide if we should test for the parvovirus. Commercially available tests can confirm a diagnosis by taking a fecal sample and testing for parvo antigens. Parvo tests that are supposed to be used specifically for dogs can usually be used for detecting feline panleuk as well, and they're used extra label by shelters for cheap and quick detection. The test shown here is a positive test, but you should be aware of when the cat you're testing was vaccinated, as the vaccine can give out false positives for up to 2 weeks past vaccination date. If you have cats and kittens dying suddenly or litters of kittens that keep dying off, it might be quicker and give a more concrete answer to necropsy the deceased cats and look for lesions on the small intestine. Shown here is a flaccid hemorrhagic small intestine indicating a panleuk infection. A healthy feline small intestine should be slightly distended, tightly coiled, and light pink in color. If our cat is positive, we want to quarantine him immediately. Even if the test we ran was negative, it still might be beneficial to isolate the suspected cat or kittens to monitor them more closely. Negative tests can occur even in cats that actually have panleuk due to timing of sampling or too much blood being present in the stool. If we have a kitten that's positive out of an entire litter, we want to move all of them to isolation together since they've all been exposed. Throw away all contaminated objects, which should include all plastics like bowls, toys, litter boxes, and also throw out all the bedding. Good supportive care can really mean life or death for these cats. Injectable Cerenia for nausea, daily subcutaneous fluids or IV fluids if you're able, NutriCal or dextrose for added calories, and warmed up rice socks to keep temperature stable are just some of the options for good nursing care. Make sure to offer high-value foods like kitten dry food, tuna, baby food, or gravy-based wet foods to entice sick cats to eat and keep hydration levels up. Affected cats should also be started on a broad-spectrum antibiotic, such as injectable Convenia or oral Clavamox, for at least 14 days. Since leukopenia is one of the hallmarks of the disease, it's important to prescribe an antibiotic that covers a range of infections. With a lack of white blood cells, kittens and cats can become very susceptible to many different secondary infections. You may also want to try an appetite stimulant if you have a kitty avoiding food, or something to help firm up stools such as Panicure or metronidazole. Cleaning protocols should always be followed to prevent spread of the virus. FPV is extremely durable and only killed by certain disinfectants. The main ones used are trifectant, accelerated hydrogen peroxide, and bleach. Bleach can be corrosive on skin and be irritating to animals, so Excel is usually preferred. If possible, use these disinfectants in daily cleanings since the virus can stay in the environment for a long time. There should only be one person who cleans the Panluke isolation kennels to minimize spread through fomites. Gloves should always be used when handling infected cats and changed between kennels. Thoroughly washing your hands between kennels can be done if no gloves are available, but it's not advised. Kennels that had infected cats in them should be deep cleaned before any new cats are placed in them. After a kennel has been stripped of all the belongings and thrown out, use an effective disinfectant to soak the kennel for at least 15 minutes, wipe it down, and then repeat. Have someone double check your work to make sure no leftover feces or spots were left behind. No plastic should be used in isolation kennels due to the porous material trapping the virus within. Only metal bowls should be used in isolation kennels, and all other materials should be able to be thrown away once the cat moves out. Proper PPE should always be worn in the isolation room, either isolation gowns and shoe covers, or ideally a Tyvek full body suit. Affected cats or kittens should be treated for at least 14 days. You should always make sure stools are solid and normal for at least 7 days before moving them out of isolation. Once they are ready to move out, it's important to bathe them with soap and water, lathering them up twice to ensure all traces of feces are cleared. The cat can then move freely through the shelter, either to surgery or adoption. Make sure all medical records are updated with tests, diagnoses, treatments, medication given, etc., so future adopters can take these home to their veterinarian. Preventing Panluke can be relatively easy. It really comes down to proper vaccination. Kittens 4 weeks and older should be vaccinated against FPV immediately upon intake to the shelter. Delaying vaccinations by even a couple of hours after intake can drastically affect immunity. One of the changes we made at my job was making sure every animal is vaccinated within an hour of intake, and it's been a huge help in cutting down our incidence of Panluke. You also need to make sure to boost the vaccine every 2 weeks for kittens until they reach 20 weeks old. The kittens will have varying degrees of maternal antibodies against FPV from their mother up to 14 to 16 weeks old. While they have these antibodies, the vaccines given to the kittens are essentially useless as the antibodies break down the virus. There's also an inevitable window of time where maternal antibodies are waning but still able to block vaccine immunity as well. So it's important to keep vaccinating the kittens every 2 weeks up to that 20-week mark to make sure they are properly immune. If you have kittens younger than 4 weeks that come into the shelter, it's very important to get them out of the shelter and into a foster home as soon as possible. A shelter is one of the most dangerous places for tiny kittens to be, as they are so vulnerable to a wide array of diseases. Proper cleaning protocols are the second best way to prevent Panluke. Cleaning every day with a disinfectant effective against FPV works very well in preventing infection. Like I've said before in this presentation, wearing gloves is vital. Hand sanitizer doesn't kill FPV. Washing your hands thoroughly with soap and water can help, but gloves are still preferred above all else. And then, of course, isolating affected cats as soon as you can stops the spread of the virus to the entire shelter population. In conclusion, FPV can cause widespread disease and death within a shelter if left unchecked. Shelters must weigh the pros and cons of trying to save one or more kittens affected with Panluke versus euthanasia. The small likelihood of a very young kitten surviving a Panluke infection versus the large likelihood of it spreading Panluke to others is a very real consideration. It might be a better option to euthanize than to have the kitten suffer and likely spread the infection around. Proper vaccination and cleaning protocols can save hundreds of kitten lives. It's important to act quickly when a pan-Luc infection is suspected, and I hope this presentation has given many tips on how to stop the spread of the virus. Thank you for listening.